On his first full day in office, President Biden signed an executive order meant to prioritize reopening the nation's schools. It's one of 10 executive orders related to the pandemic that the president signed Thursday. He says that he wants to see most of the nation's K-12 students back in the classroom by April. With more on the Biden administration's plans to do this, now let's bring in Dr. Rajiv Shah. He's the president of the Rockefeller Foundation and former administrator of the U.S. Agency for International Development. So, Doctor, I think that, most experts in this area believe that getting the kids back in school is certainly better for their education, for their mental health. Is it better for their physical health, though? Is this a realistic timeline to get them back in the schools by April?
Well, thank you for having me. And the answer to your question, I think, is unequivocal. Absolutely. And the reason that's true is because we now have mountains of data from across the United States and, frankly, from around the world that shows that even when the background community rates of transmission are relatively high, say 1% of the population, even in those settings, we're seeing school rates be quite low, about 0.14% for kids and 0.36% for teachers. And what that effectively means is in almost every part of the United States, if you do some basic things, you take the right types of precautions, you enable social distancing, you have universal mask wearing, you change some practices in how you run a school, and you introduce more frequent testing so that you can take people who might be positive out of the chain of transmission, you can safely open America's schools and safely ensure that America's 55 million school children get back in a learning environment.
So, Doctor, during your time in the Obama administration, you led the fight against the Ebola crisis, and you worked alongside Ron Klain, who, of course, is now President Biden's chief of staff. How do you think he'll apply the lessons learned during that time when it comes to handling the coronavirus pandemic, obviously with the understanding that Ebola was a much different type of infection, and we didn't have a global pandemic, at least not in the United States?
Well, look, I can't speak for the Biden administration. What I can say is that Ron Klain, Jeff Zients, the COVID-19 coordinator at the White House, the teams they've built, the Surgeon General, Vivek Murthy, and his team, are all deeply committed to doing this in a data-driven, science-based way. I think you saw that in the introduction of the plan that they've put out. You see that in the request for resources they've put forward so that we can adequately fund an effort to reopen America's schools and ensure we take the burden of investing in public health off of the backs of local school districts and teachers and kids. And you see that throughout the way they're approaching this. And I think the science here is very clear. I'd say a year ago, we didn't really know, would schools be a safe place? Today, we actually know that a school that takes the right precautions is safer than the background community. Today, we know that children are unlikely to be causes of transmission. Sometimes teachers and adults might be, but with adequate testing, you can protect against that. And today, we can look at case examples, as I know the administration is doing, in Colorado, in Florida, in parts of the country, New Orleans and Massachusetts, where they are taking this approach, Connecticut, and effectively opening schools. We're a big, diverse country, and what happens is if you keep these schools shut, we see that kids are not learning. They're losing a tremendous amount of learning, especially minority and lower income kids. We see that child abuse that goes unreported has gone up because schools are such an important safety net. We see skyrocketing child hunger. And the Biden administration has taken strong action on that just yesterday. So I'm encouraged that this is a science and data-focused team, and the data and science here are quite clear about how to reopen schools with the right investment and the right national priorities. We can get this done on behalf of America's kids.
Doctor, one of the things that this pandemic has done, though, is kind of put a spotlight on the ongoing inequalities in this country. And definitely when it comes to education, that was almost immediately an issue. There were conversations about how do you get, even if you can get laptops to every child in certain communities, they don't have good Wi-Fi, so they're not able to, participate. And I think about even, where I live and the school that my child goes to is a very small, or much smaller than when I grew up, kids in the class. So they're able to social distance. It's very different in the public school system here in Philadelphia, where there are many more children per classroom. In order to go forward with this, the inequalities within the school system have to be addressed. The school systems across the country have to be addressed as well, right?
Well, absolutely. And just to be clear, I think as you've just said, reopening our schools and getting kids back in an in-person learning environment is the key inequity issue that we need to address and address right now and have a chance to solve even this semester. And while it is obviously and critically more difficult to safely reopen schools that are larger, that have crowding problems, that have been underinvested in for decades, where teachers are often reaching in their own pocket to buy masks and buy protective equipment for themselves and for their students, which is unbelievable but happens in this country. A simple program that has the right public investment tied to the right public health science-based strategy, making sure masks are available, putting up plexiglass dividers, ensuring appropriate ventilation in schools, and testing frequently so that you can actually not be afraid. You can track when your testing prevalence rate gets to a level where you have to shut things down to be safe. But we're not near that in nearly all parts of the country. And where we've tried this, New York City is perhaps the largest successful example. It has worked, and it will work, and the science indicates it'll work. And you're absolutely right. It requires public investment in America's schools and America's public schools in particular.
So to that point, Doctor, the president also wants to provide reimbursements to schools for PPE through FEMA, the FEMA Relief Fund. As history shows, funds are not always dispersed appropriately. So how can this be done fairly and justly?
Well, look, I've had the opportunity to lead a number of global emergency response efforts after the Haiti earthquake and typhoon in the Philippines, et cetera, a famine in Somalia. It's always hard to ensure that you can account for every dollar in the moment of crisis. So the first and foremost thing we have to do is unlock the expertise and the capabilities that we have as a country. The FEMA is capable of moving resources quickly, of getting protective equipment to schools quickly, of putting in place reimbursement mechanisms that can in fact work. These are practiced agencies with real capabilities, and now it does seem like we're bringing the full force of the American government to the task of getting kids back to school, to the task of expanding testing and diagnostics in America, to the task of vaccinating every American, and to the task of doing our very best to encourage every American to wear masks. If we do those things together with the capabilities of agencies and federal resources backing them, we can get this done. We've done this so many times in our history where we just tackled a challenge that we face. Here, the Rockefeller Foundation's helped pull together maybe 150 scientists and educators, former education secretaries, teachers' unions leaders like Randy Weingarten, and developed a plan that we put forth in December that has many of the same contours, and we believe and we are confident this can be implemented effectively.
The rollout of vaccine distribution has been somewhat bumpy, though, and now we're getting to the point where, certain states are saying that they have run out of vaccine, that sometimes people are waiting in lines for a very, very long time in order to get these schools back open. And this is like keeping in mind that children are not even being vaccinated, right? But it's certainly getting teachers vaccinated would be important in order to keep this timeline of getting the kids back behind the desk, in-person learning by April. How crucial is it to have the vaccine distribution system made more efficient?
Well, that's an important part of this proposal. I will say, Rockefeller works directly with states and has been for the past year to help them optimize their response. Our recommendation to states has been to move teachers up the line into what's called Phase 1B of the vaccination schedule, so that they can quickly and effectively get access. The reason for that, of course, is ensuring that you can reopen schools and offer the kind of workforce safety to that community of educators is just so critical to helping our economy function. We've seen economists have indicated that reopening schools and reopening certain essential services will help generate north of $300 billion a month in GDP as people have more flexibility and capacity to participate in the economy. So this is both a critical issue around educational loss for children, a key issue around child welfare and well-being, but it's also a macroeconomic stimulus effectively if we can get this done right. And in that context, making the investments to expand access to vaccines, asking states and governors to really focus on teachers after they've covered essential healthcare workers that are on the absolute front lines of risk, and opening up the pipelines as they've suggested they're going to ensure that there are many more access points for vaccination in the community, as we're seeing work in states like Massachusetts, for example, is a critical part of the solution.
Dr. Rajiv Shah, thank you so much, sir. Always great to have you. Appreciate it.
Thanks for having me.